Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. There's a short clip about the NHS Test and Trace service. It's operational from just before the weekend, and this is a short clip on how it works. So the entry point is if you develop coronavirus symptoms, you should self-isolate for at least 7 days, and anyone in your household should self-isolate for 14 days from when your symptoms started. That's the standard advice on the stay-at-home message that's been in place for at least a couple of months now. The symptoms, persistent continuous cough and or fever and or loss of smell, which was newly introduced a couple of weeks ago. If you develop symptoms, get yourself a test. So nhs.uk/coronavirus or call 119 if you have no internet access. Get yourself a test. The results should come back fairly quickly. If that test is positive, then you should complete the remainder of your 7 days in isolation, and anyone in your household should complete 14 days of isolation from when your symptoms started. If your test is negative, clearly that's fantastic, and you and household members no longer need to isolate. Second point is share your contacts. The service will contact you and ask you to share details of who you've been in contact with for 15 minutes or more for the past 24 or 48 hours. And you should share those as soon as possible, because speed matters. Speed really matters. One of the ways that track and trace will work best is if they get on top of who the contacts are really quickly. So the service will then contact your contacts, usually by text message, possibly by email, and it will ask your contacts to log on to the Test and Trace website, and they will then be contacted by one of the staff that work for NHS Test and Trace. Your contacts will be asked to isolate for 14 days. And it's important they do this, because even if they don't become unwell or they don't feel unwell, it may be a really mild illness that they have, and that is still infectious to others, and it can take 14 days for the symptoms to develop. If your contacts develop symptoms, then they need to get a test. And then we go back to the starting point. So that's the basics of the NHS Test and Trace service. It is now operational, and I would guess that a significant number of people in Sheffield have been contacted already. If you don't get contacted, you clearly don't need to do anything, and it is very much for those who develop symptoms and test positive and their immediate contact. It is one of the ways that we will get on top of the virus and interrupt the chain of transmission. It's not the only way. So some of the other stuff around maintaining distance, washing hands regularly, not congregating in large groups in the park or wherever, all of those things also matter, and matter a lot. But the track and trace service is one of the things that we will get a handle on this and break the chain of transmission pretty quickly.